Hi, my name is Abby Sturz. I'm a 7th semester nursing student at Lincoln University. Today's date is September 15, 2017, and the time is approximately 10:15 in the morning. So today I'm going to perform trach suctioning and trach care on my patient. So I have identified and reviewed my physician's orders for the need for trach suctioning, and I am ready to go into my patient's room. I've gone into my patient's room, I've performed hand hygiene, provided my patient with privacy, I've introduced myself to my patient, identified my patient using 2 patient identifiers. I have also explained the procedure to my patient and what we will be doing. I have answered any questions that they may have, and we have also identified a form of communication when throughout the procedure if he needs anything. I have also raised my patient into a comfortable working height, and I have all my supplies ready, and I have hooked up my suctioning to 80 to 120 millimeters per mercury. At this point, I would want to listen to my patient, assess respiratory status, check their lung sounds, and to see that suctioning really is needed. I've also communicated identified a way of communication, and now I'm ready to begin. So I'll open my kit away from me. I can fix my gloves now because both of my sterile gloves are on. I'll go ahead and throw this away. At this point now, I'm going to go ahead and check out my suctioning tube to make sure that it is intact, that there's any malfunctions about it from the manufacturer. And it looks good, so I'm going to go ahead and place that back inside of my kit for right now and go ahead and open up my water, my normal saline. So at this point, I want to pick a hand that is going to be clean and to pick a hand that's going to be dirty. Since I'm right-handed, I'm going to go ahead and keep my right hand as my clean hand. So I'll go ahead and at this point, I want to hook up my tubing to my suction. So I'm going to go ahead and hook it up. And then I'm going to go ahead and what I'm going to do now is I'm going to lubricate my tip and make sure that my suction is actually working, which it is. So at this point, I'm going to go ahead and remove my patient's oxygen off and begin. So I have told my patient that I will insert the suction until he begins coughing, and then I will remove it. So at this point, I want to go ahead, replace my oxygen on my patient, give it about 30 seconds to a minute so he can get his oxygenation back, and go ahead and re-lubricate my tip and clean it out. So about 30 seconds to a minute have passed, so I'm going to go ahead and begin again. And I'm going to once again remove my oxygen off my patient. And tell him again that I'm going to put this down his trach until he begins coughing, and then I will slowly remove it. At this point, I've now finished suctioning, and I have gone ahead and listened to his lungs so I can disconnect it and throw this away. Like I said, I would have listened to his lung sounds, made sure that they seemed clear. I would have checked respiratory rate, and I would check his O2 stats to make sure that they are where they need to be. At this point, I would want to lower my patient back down, and then I would want to make sure that the call light is within reach, ask if there's anything else that they need at the moment, and then I would want to take and go ahead and go out and document my procedure and document the amount and the quantity and the quality of the suctions that were suctioned out of him. I'm going to go ahead and have my station cleaned up. During this point, I have received orders to perform trach care on my patient. So I have reviewed the orders from my physician that trach care is needed on my patient. So once again, I've gone into my patient's room, re-identified myself, identified my patient again using 2 patient identifiers, performed hand hygiene, provided my patient with privacy, and explained the procedure to my patient. I've also answered questions that they may have, and we have also re-established our means of communication in case something was needed throughout the procedure. I've again listened to his lung sounds just to make sure that before I started trach care, suctioning was not needed. So now I'm going to go ahead and begin. Open my kit away from me. Go ahead and refix my gloves and go ahead and throw this away. So at this point, I can go ahead and set up my sterile field. I need to check with my facilities policies to see exactly what kind of mixture I need to be cleaning the solution in or cleaning my trach in. So I'm going to go ahead and get out everything that I need, and for my purposes today, I'm going to go ahead and mix half and half with half hydrogen peroxide and half normal saline. I've also in this kit got my Q-tips, my cleaning brush, my pipe cleaners, clean gauze, and a pre-cut gauze for the trach. I also have a new trach tie. So at this point, I'm going to go ahead and mix my water and my hydrogen peroxide. Okay, so now I'm going to go ahead and pick a hand that's going to be dirty and a hand that's going to be clean. Once again, I'm right-handed, so I'm going to use my left hand as my dirty and remove the oxygen. At this point, I can go ahead and take out the trach. What I'm going to do now is I'm going to go ahead and put it into my hydrogen peroxide and my normal saline mixture. Let it soak for a little bit and go ahead and get my cleaning brush. So after it is soaked, I'm going to go ahead and pick it back up and clean it, making sure to get all of the gunk and secretions or whatever has built up on it. So now I can go ahead and throw that away, and I can put this into my just my saline solution to rinse it off. I'll let it rinse off, and I'm going to go ahead and take it back out. I'll tap it on the inside here just to get the excess water out, and I'll let it dry. So at this point, I'm going to go ahead and make sure that my field is set up and I'm ready to go. I'm going to go ahead and replace my trach back into my patient using my clean hand. I will make sure that it locks. I may have to twist it some in order to get it in. Which it has locked. So I'm going to go ahead and replace the oxygen back on my patient just to make sure that his oxygen is ready. So I'm going to go ahead and get my Q-tips ready and my gauze ready, which my gauze I could have already had pre-soaking to clean around it. I'm going to remove the oxygen once again and just clean around my patient's trach, making sure to get all the gunk. You can get another Q-tip. Most times patients will have a dressing already underneath of their trach, which is, my patient does not right now, so I'm going to go ahead and we'll reapply one after that. But I'm going to go ahead and use another wet gauze to go ahead and just do one more clean around it. Throw that away. And then I'm going to make sure that it is completely dried off before replacing. So at this point, I'm going to go ahead and get my ties ready to be put back on. I don't want to untie both sides due to the fact that if they would cough, the trach could come out. So I'm going to go ahead and put this side in before I get my dressing. Hook that on. grab my dressing. And place this underneath of the trach. I can go ahead and try to get as much as I can in on that side and then finish it once I get to the other side untied. So I'm going to go ahead and finish putting in the dressing. Go ahead and secure the trach now. So at this point I want to reapply my oxygen just to make sure and give my patient to bring his oxygen saturation back up. So at this point I have finished my trach care, and I will go ahead and remove my gloves. I will reassess my patient, check respiratory status, check the lungs, and go ahead and lower my patient back down, make sure the call light is within reach, and then ask if there is anything that they would need at this moment. And then I would take and go out, document my findings, document how well my patient tolerated the procedure, the date and time, and any findings that I found with the trach.